Hi, this is Dr. Rachel Brown, Medical Director of Prevention and Wellness at Business Health Solutions at Prisma Health. And this is this week's COVID and Wellness Update. Not a lot of change from last week, but let me remind you, today is February 26th. If you were watching this anytime after February 26th, some information may have changed. So be sure you reach out to us to clarify if you have any questions. I'm going to jump right in today. We are seeing some great numbers across the state. The incidence per 100,000 in each county is dropping. We're still not below, in most counties, that 200 mark that we'd like to see to put us in the moderate to low risk category. But the percent positives are falling as well in every category. The average for the state for South Carolina was 8 as of today. That was over the last 2 weeks, and yesterday's percent positive was 7.3. So really great. I'm going to start sharing my screen as I always do to show you some of the resources to keep. Let's start with our DHEC resource. If you remember, we can always check and see who's eligible for the vaccine right now. We are still in phase 1A. You may remember we've added the age group 65 and older. And if you are curious as to whether you are eligible and in this group, all you got to do is scroll down and take a look at this list. Let's look at our 1Bs. Not sure when this is going to happen. It's getting closer and closer. We're hoping to hear soon about whether our essential workers become eligible. You can see that DHEC has already identified several groups within the essential worker category, and you can expect that once 1B is announced, we will get more information, more particular information around the specific worker areas that are eligible for vaccination. The next site I want to show you is how you can get your vaccination if you are one of these folks who's eligible. Let's see if we can get this to go away. There we go. All right, so if you head to the Prisma Health COVID-19 website, you can see it's been a little reorganized. It's very easy to navigate. You can check to see if you're eligible for the vaccine or your workforce is eligible for the vaccine. That has the information on it that I just showed you from DHEC. Or you can get the vaccine. And we do this at Prisma Health through the MyChart patient portal and a phone number if you don't feel comfortable registering for MyChart on your own. Okay, Business Health has been working on developing a system to mass register your employees, and as soon as we have that procedure nailed down, we'll reach out to you and let you know what that looks like. The other thing you can do from this page is if you are eligible to get the vaccine and you have signed up and registered or been registered, you can find your vaccination site. Now, this is an incredibly important web page because it is updated hourly, and it will tell you whether a particular site that you're registered for is taking first dose walk-ins, second dose walk-ins, if they have run out, if there are new hours coming, if there's some weather changes that are gonna change your plan. So be sure to check this before you head out for your vaccine. Okay, I'm going to stop sharing for just a second so we can talk about a few other updates. Everyone's been asking me, when is 1B going to become eligible and when are teachers going to become eligible? Well, teachers are part of that 1B group, but as you know, there's been a lot of talk about whether to begin vaccinating them before an official, eligibility of phase 1B. We still haven't heard yet. Maybe even by the time this video is posted and you're watching it, we'll hear some word about that. And certainly the moment we know that our business partners out there their workforces are ready to be vaccinated, we're going to let you know. The other thing that's exciting is, as of today, February 26th, Johnson & Johnson is under independent review. So hopefully within a few days, we're going to hear that a third vaccine has received emergency use authorization. And as I've mentioned before, the Johnson & Johnson vaccine is 1 dose and does not need to be frozen. So we can get this vaccine out to folks a whole lot easier than some of the other vaccines. And here's my advice to folks who ask me about this. There are differences among the vaccines in terms of rate of effectiveness, but they all have incredibly high rates, even better than the typical kind of flu vaccine. So get whatever vaccine you can get. Don't hold out for an mRNA vaccine if you can get the Johnson & Johnson vaccine. And then the other great news we heard today is that Pfizer has officially said that we do not have to store their vaccine at ultra cold temperatures for a short period of time before the vaccine is administered. This again will make administering the Pfizer vaccine a lot easier. And since that's the vaccine that Prisma Health uses, we're hoping that this will also open up our ability to provide access through our mobile clinics, our primary care sites and ambulatory care offices, and on-site vaccine clinics. So again, we're planning for that behind the scenes while we're waiting for that 1B eligibility announcement, which hopefully will come sometime soon. A lot of you ask me about variants and does this mean we're going to need to get boosters? And we don't know yet, okay? I will tell you that there has been that talk in the lay press, but no one has officially announced that there will be a need for a booster. I think it's helpful for me to show you a graphic that will explain the difference between mutation. Let's pull that up for you, between mutation, variant, and strain. And so if you get these questions, you'll feel empowered to answer them. Let's say we have our original COVID virus here, and it's got genetic code. That's how it replicates. That's how it makes more of itself. We expect with every virus for small changes in that genetic code called mutations to happen. It happens with all viruses. It happens every season. And so what you end up with is a slightly different version of the original virus, and that's called a variant. However, if there are enough changes to that RNA that the different version of the virus behaves differently, that's called a strain. And sometimes those behaviors don't mean a whole lot to us in terms of managing this the virus in public health sector, and sometimes it does have a lot of significance. So for instance, you probably have heard that one of the COVID virus strains is more infectious, and so it can be more easily transmissible. That means it's had a change in behavior and therefore is called a strain. What's important is whether that change in behavior or those changing characteristics render the vaccines less effective against them. And the preliminary data shows that while there may not be a 95% effectiveness like we've seen with the original COVID virus, there's still a very high rate of effectiveness. And so these vaccines are still felt to be very effective against the strains and the variants that we're seeing. Yet the FDA has started or has issued an encouragement and a directive to the manufacturers of these vaccines that are out and also in phase 3 trials to start looking at their effectiveness and what they need to do to manage the variants. So whether that means a booster, we don't know. Whether that means we'll have vaccinations, coming that tend to target the variants a little bit better than our original vaccines, probably. But that does not change our course, okay? That does not change the effectiveness of our vaccine efforts now, and does not change that if you are eligible to get vaccinated, go out there and get vaccinated. Let me review really quickly some new quarantine rules. We've reviewed before that folks with COVID positive need to isolate, who are COVID positive, need to isolate for 10 days. We've talked at length about how folks who are exposed to someone who's COVID positive can quarantine now for either 7 days with a negative COVID test on day 5, for 10 days, or for 14 days, as long as they don't develop symptoms. But you may or may not have heard that if someone has been vaccinated, and it's 2 weeks from their second dose, or someone who's had COVID and it's within the first 90 days of their recovery, those folks do not need to quarantine if they're exposed to someone with COVID. This is really great news. So there may be many on your workforce who either have had COVID or have been vaccinated, who are exposed to COVID positive folks, and it's within that first 90 days after recovery or vaccination. They don't need to go home. They don't need to quarantine. So this is really great news, and it's exciting and hopeful. The last thing I want to mention is I want to remind everyone that as we approach the year anniversary of COVID in South Carolina, we need to renew our efforts at attending to our workforce's emotional and mental well-being. It has been a long year for everyone, whether they've been in tragic situations or things have actually been fairly okay over the last year. Everyone has been under chronic stress, and everyone is going to manifest the impact of this past year on their lives in different ways. So it's important for leaders, business leaders, to understand that their workforce is tired and weary and struggling and disappointed and sad and angry and anxious and all of those things from time to time. So we encourage you to set up ways for your workforce to share, whether that's a organization-wide event, whether it's more intimate within a work unit, or even just leaders really connecting with each of their team members and asking how they're doing. And we also encourage you at this stage to reiterate and reemphasize the employee assistance programs and counseling support that you have for your workforces. And not just to emphasize them, but to destigmatize them and to let your workforce know that every single person is struggling at some level. Some have great coping skills, some have not so great coping skills, some have more tragic circumstances in their work and personal lives than others, but that everyone needs to tend to their emotional well-being, and therefore there is no stigma. There's nothing wrong with someone for visiting those assistance programs or those counseling support services. We all need to get stuff off our chests from time to time, and we've had a lot to get off our chest in the last year. So please reach out to us. Go to our Creating a Safer and Healthier Workplace webpage at Prisma Health. There's a number there that you can reach out to us if you want to talk more about emotional and mental well-being programs for your workforce. You need guidance around how to manage COVID exposures. You want to talk some more about the vaccine, whatever that is, please reach out to us, because we're here to care for you so you can care for your workforce.